Today, we're going to talk about the neck. What is a neck really? The neck is the highway, the connection between the head, the brain, and the body. The head has all of the five senses of perception that we use to assimilate and discern our daily lives and to know what's going on around us. We have our sight, our smell, our hearing, our taste, and our talking, of course, and the touch. So the head has all five senses, and it's connected through the body, through that neck, which is the connector. The neck, obviously, is what steers the head. The neck has the bones of the spine, which are 7, and they're called cervicals, and they're numbered from the top, C1, cervical 1, to the last one, cervical 7 or C7. The 7, you can kind of feel it. It kind of sticks out on most people, and it's a little landmark. The first 2 cervicals of the spine, the atlas and the axis, 1 and 2, are the ones that do most of the rotating and extending and flexing. In addition to the other cervicals, those first 2 are different shape and are critical. The bones of the spine are all different from each other, but the neck ones in particular are the ones that have the highest ranges and most intricate ranges of motion and articulation out of all the spinal bones, the thoracic and the lumbar and the sacral. The neck bones have the most ranges of articulation, they're the most intricate, and they can be amongst the most delicate. A lot of people suffer all kinds of stress and injuries of the neck. We're going to talk about that this month. Today, I want you to understand that when you are standing up, because of the series of curves in the spine, the neck is stronger. So, if you were to have a blunt force trauma, knock wood, no, and you are standing, it is less of an impact on the neck. If you're bent forward, you know how the football players bend forward and do that huddle thing, the rugby players, they are now flattening their spine and reducing and eliminating, depending on the angle, the lordotic or the curl of the spine, the thoracic and lombardic arches, and that puts a lot more stress on the neck. So if you're bending forward and somebody bonks you on the head, you're more likely to have a neck injury as opposed to standing. Sitting, of course, is worse than standing because, again, sitting, you lose most of the arches of the back and you're left with whatever arch you have of the neck. So, of course, car injuries and stuff like that where you have a whiplash, where the body is stable, but the head keeps traveling and the neck slaps back and forth. That whiplash can cause all kinds of pain and issues in the neck. It is important that you stabilize and strengthen all of those neck muscles, which, of course, Pilates, done correctly, will strengthen the neck muscles with different kinds of contractions, eccentric and concentric and isometric contractions. Don't worry if you don't understand or know any of that. I take care of all of that for you. This is Pilates Master Nikki. I always stick my neck out and take care of your neck. And I'll see you in class. Today we're going to talk about the neck and how the posture or lack of posture and alignment of the neck can lead to droopy eyelids. Oh, yes, yes, yes. You can Botox and nip and tuck those eyes all you want. If your neck, for example, bulges forward and downward, the eyes will come out of the socket and cause the lids to droop because your body is programmed for survival. If there's something flying at you, your eyes automatically close. You may jerk back. If there's something hot or pinchy, your hand automatically jerks back. These are natural instincts that are programmed for you for survival and for protection of the body. By the same token, Your eyes always have to be in alignment with the horizon. If your neck position is incorrect, your eyes will come outward and upward, causing that droopy eyelid, those saggy underneath eye bags, is also caused by improper neck alignment and neck positioning. When you do Pilates that is done correctly, and we use that cervical arch pillow under the neck, or you roll up a little hand towel to simulate the arch of the neck, that reinforces proper neck alignment and helps strengthen all the neck muscles so that your head can be in the correct position, so that your eyes have the right angle of gaze at the horizon and will not have your eyes bulge forward and downward in the droopy eye syndrome. This is Pilates Master Nikki, and I'll see you with a straight horizon line in class. Today, we're going to talk about a modern phenomena known as tech neck, from too much keyboarding, too much texting and phone looking and scrolling right or left. I don't know, is it right or left if you like the person? And of course, the driving. That causes a phenomena known as forward neck, where the neck comes forward and it elevates the shoulders and it hunches the back. You may call that the hunchback, or you may call that kyphosis, but in essence, it really is that the neck has jutted forward, and it's from repetitive motion that's done in a improper alignment. When you have this forward neck, it lifts the shoulders upward. We're going to talk about this in further on in the month. That lifting of the shoulder puts pressure on the major arteries and lymph system that flush out the head, especially that eye, nose, ear, throat connection, and you will collect fat cells and fat underneath the chin just from the alignment. So when my shoulders are up and forward, look at what it does to the neck and chin. When they're down and back with a proper arch, it flattens that chin. Now, you may run and have surgery to suck out that fat and tuck it back. Great. It'll look great for a while, but the sad news is that that fat will return when you continue to have an improper alignment of that neck and chin. When you do proper Pilates that's done with the right sequence of exercises and with the right support of that neck, that will help you eliminate the double chin. Double chin is not hereditary. You may have it because you have the same posture as someone else in your family. So here's a quick little Pilates mat thing that you can do without any equipment. Grab a little hand towel, bring it behind you with your palms facing back, squeeze your belly, and keep your chin level. This is best done in front of a mirror. So I'm going to pull gently outward on the towel, outward, without the shoulders popping up. After you pull outward gently 5 times, keep that belly engaged, and see if you can gently lift the towel 5 or 8 times without the shoulders popping up, without the head jutting forward or down, without the belly pooching out. After you've done 5 or 8, keep pulling on the towel and bend and straighten those elbows, keeping that chin and head level with your stomach squeezing inward, and always the largest distance between the ears and the shoulders. This is Pilates Master Nikki. I'll see you in class. Mat Reformer, Cadillac, or Wonder Chair, you pick. I'll see you there. Today we're going to talk about the silver cords of the neck. You may have heard about those silver cords of the neck. If you put your fingers at the base of the skull where that little notch there is, that is where the very first cervical atlas attaches to the actual skull, the occipital bone there. And that very first cervical or neck bone has a much different shape from others. That spot there has been measured to be a high energy vortex of the body. Ancients believed, from Hermes to Socrates, believed that that spot there, that occipital, if you put your little fingertips there, you can feel it. That occipital spot is where the silver cords are that attach and keep the soul to the body, tied to the body. And when you dream or have astral projections, that the soul comes up and out of the body in your dream world, but those cords keep it attached to the body so that you can wake up in the morning and still be in your body. So the science has measured, in fact, that that is a high energy spot. Proper alignment of the neck gives you energy and forza vital of the body. When that head is placed properly, you're alert, your flow is better, your energy is better, and you're feeling better. So here's the quick little thing that you can do if you're tired from working, typing, texting, or driving. Find a quiet spot, not when you're driving, and just put your fingertips at the base of the skull there where you feel that little notch, and then bring your thumbs forward right here by the ear underneath your jawline here. Gently, with your elbows wide, drop the shoulders down, squeeze the belly a little, and gently, just with your fingertips in that divot, give a little lift upward. And with your hands, trace little circles with your nose, itty-bitty circles. You can also do this laying down with your knees in a bend, and just pull gently your head upward away from the shoulders as the shoulders go down, and just doing those little bitty nose circles releases all the tension and resets the alignment of that cervical or neck part of your spine. This is Pilates Master Nikki, and I have the fix for that neck. I'll see you in class. Today we're going to talk about your neck and the importance it plays for your immune system. Your immune system, which is mainly maintained, yes, by your gut, yes, by a lot of things, but the lymphatic system is one of the first defenses in the immune system. If you have improper neck alignment and you have a sunken first rib, that first very rib and clavicle area is an area where it is a super highway of energy and blood flow to the head and to the body. All of the neck muscles that connect the head to the body run through and pass under that first clavicle here underneath the neck. So if you have a sunken chest, if you have shoulders that are rolled forward, if you have shoulders that go up, if you have a forward neck, if you have a back neck, the flow of energy through the lymphatic system that is going up and around your brain and your head becomes restricted. You have over 600 lymphatic nodes in the body, and over 160 of them are in the head and neck alone. So that's a high percentage. So this first little clavicle here at the base of the neck, when it's sunken inward, it affects your thyroid muscle. It affects your thyroid gland, It affects your carotid gland. And that gland is responsible for the level of oxygen that is dispersed in the blood. So your energy levels will change. When that first clavicle and rib is depressed, the sternum sinks downward, and that puts pressure on the bottom of your abs, known as pelvic floor, and all the organs sink downward and creates indigestion and all kinds of problems. So the gut, that is where the immune system, the lymphatic is where the immune system are maintained, propelled, and used to keep the body healthy, are put at risk with the sinking unalignment of the neck and shoulder area, which again is caused by improper neck alignment. When we are in Pilates class, we usually work with that small little neck pillow under the neck that creates an arch, or we roll up a towel. When we're standing, we're always paying much attention that the shoulders are far from the ears. I teach you how to activate that waist. So let's do that. Put your hand there on the chair or table next to you. Put the other hand on your waist. Push down on that surface and see if you can feel that waist muscle activate just a little bit. Bring the hand higher up if you're having trouble. Once you feel that that muscle is turned on or activated, you're going to notice that that brings the shoulders down. The turning on of the waist activates the muscles that pull the shoulders down and helps bring that neck posture back into a beautiful alignment. This is Pilates Master Nikki. I have all the tricks to fix that neck. I'll see you in class. Today we're going to talk about headaches. Did you know that 1 out of 10 people will suffer from a headache or a migraine? Headaches and migraines are the most disabling neurovascular disorder worldwide. It is a $13 billion industry between all kinds of things, vasoactive compounds to help relieve and pull people out of those horrible headaches and migraines. Misalignment of the neck is one of the major causes of the headache due to a trauma or bad neck alignment or bad posture, repetitive motions, and things of the such. So what happens is you get a reduction in blood flow and cerebral fluid from the body into the brain. There is a lack of communication between the body and the brain, and that stress sends out a survival signal that gives you a headache to force you to stop, to lay down, so that you can have better flow of the body-brain connection, not just cerebral fluid. The body and brain contact each other all day long. And if there's a disruption, that sends out a 911 and your body can create a horrible headache. Modern medicine, right, the vasoactive compounds can help you relieve that neck headache pain, but it is not going to help you realign the neck position for better fluid flow between head and body. So a lot of things can cause those headaches. We discussed that the C1 trauma, the cervical 1 trauma, cervical 2 trauma, neck, whiplash, improper neck alignment from modern neck, the tech neck, forward neck, back neck, so on and so forth. It's important that you try to maintain a good neck alignment when you're doing exercise. Remember, just as Jell-O, when you make Jell-O and it's hot and liquid and you put it in a container that's like this, when it hardens up, it's like this. You're the same. If you're working out and grunting in the gym and lifting your shoulders, you're doing that chest, you're on that spin bike, you're all hunched up, you're jogging, you're carrying your water bottle and your phone, you are enhancing a bad neck position. So it's important that you maintain a good neck position when you're working out, that you do things that enhance the neck position like Pilates, and you will have a better quality of life and reduce those pesky headaches and migraines. This is Pilates Master Nikki, and I am not a pain in the neck. Pain in the ass? Yes. I'll see you in class. Today, we're going to continue to talk about proper neck alignment. Do you wake up with a groggy head in the morning? Do you wake up with a crink in your neck? It may be time to reassess your pillow. When you are laying down, if you are broader or less broader from point of shoulder to the end of the ear is going to dictate your proper pillow height. So if I was laying on my bed and this is the bed here, this would be a good height pillow for me. If my pillow is too high, I'm going to be sleeping like this. But Goldilocks, if the porridge is too cold, if the pillow is too low, you're sleeping with your head at this angle. Feather pillows and foam pillows over time start to lose their springiness. Sometimes you can wash them, or before you go to bed, you fluff them up, and that may help. But you may need to change your pillow. When you're sleeping, if you have your head forward and down, and then you're side bending, and you're all cramped up, and you're sleeping like this, most of us sleep between 6 and 8 hours. Can you see how that is going to enhance a bad neck alignment and neck posture? Try to feel your pillow and see that your pillow supports you, whether you sleep on your side or on your back. Also, when you're driving your car, your elbow should never, never, never be so lifted when you're resting your elbows on your elbow rest there that your shoulders pop upward. When you're sitting at your desk, you should try to have your hand the height of your elbow, or preferably lower, so that you're not sitting with your shoulders lifted. If you have your neck 1/4 of a millimeter forward, you have improper circulation to the head and improper neck. You see how small it is. So pay attention to the car, pay attention to the keyboard, and pay attention to come and see me in class. This is Pilates Master Nikki, and I'll see you in class online, and we fix that technique. Today, we're going to talk about that pesky little pest known as TMJ. What is that anyway? TMJ stands for temporomandibular joint issues. So you have two hinges where your jawbones attach to the skull. Those are hinges. There's a whole bunch of muscles and ligaments that attach this jaw on either side to the skull. When you have a misalignment or a strain, that causes issues that can give all kinds of symptoms. So, some of the symptoms that you may have a TMJ, believe it or not, can be something as crazy as constant earaches. Constant earaches. Toothaches. Sometimes it's not the tooth, it's really the TMJ. Shoulder pain. Neck pain. Migraines. Headaches. Jaw pain. Difficulty opening and closing the mouth. Difficulty chewing or swallowing. So these are all little symptoms that you may have, that you may think you have one thing, but it's really a TMJ. Obviously, a medical person can assess exactly if you have a TMJ, a dentist, or someone that has a white jacket on. I'm joking, a doctor. What causes TMJ? Obviously trauma, right? Someone punches you, God forbid, in the jaw, you have a fall, you have a car injury, a blunt force trauma. Okay, that's a given. But you can have a malocclusion, which is the teeth stop fitting properly. When you chew, you may not be aware of it, and it starts to strain and pull out of alignment so that the dentist would handle, right? Okay, bad neck alignment. Yes, hunched shoulders, tech neck can lead to TMJ. Sleeping on your belly. A lot of sleeping on the belly affects the length of those jaw and neck muscles. Here is one that made me laugh, right? So, too much chewing on ice, but also chewing pencils. I thought that was hysterical. People that chew all day. So if you chew too much gum, because you chew, you're chewing gum for 6 hours. You don't eat for 6 hours. It's good to chew. It's good to exercise your face. We actually do TMJ exercises in a lot of the classes, but overuse, right? Chewing pencils. I thought that was hysterical. Also, stress. People get stressed, they clench their jaws, they clench their teeth. Teeth grinding when you're sleeping, you may be a grinder. So what is an easy cure? Some of the cures, well, some of the tests for TMJ, you have to go to someone with a white jacket. They'll do a CT scan. They'll do an MRI. Okay. There are things that you can take over the counter, pain relief, muscle relaxants. Sometimes doctors will prescribe antidepressants to people that have elevated stress that is causing their TMJ, but I prefer Pilates for TMJ. Also, sleeping with a mouth guard if you're a grinder. There is ultrasound therapy that does work, electrostim therapy, stimulation, electrostim. That's what we call it in the jargon. Electrostimulation therapy that also does work. And in worst case scenarios, obviously after blunt force trauma, surgery also can be used to alleviate that. But Pilates will help you with stress, and Pilates will help you with that neck alignment to avoid and help relieve TMJ. This is Pilates Master Nikki, and I look forward to seeing you in class.